This week, I wanted to take some time to explore the Trans-Pacific Partnership. It's a free trade agreement that you might have been hearing a lot about in some other areas of the news, but maybe not so much in health. And it might kind of sound like an interesting or odd choice of news stories for a doctor to be weighing in on, but I can tell you that part of the reason why I'm weighing in on this was because I'm not the first doctor to talk about the Trans-Pacific Partnership, TPP. And the way it came to my attention was when groups that I really respect, like Doctors Without Borders, the American Foundation for AIDS Research, activists who care about Medicare, when all of them started expressing concerns and skepticism about the TPP free trade agreement, I decided I wanted to take a closer look and get a better understanding of what's going on. And when I did, I was actually really surprised by how much this free trade agreement actually has a big impact on patient care, on medications, on public health campaigns. And so I felt that we need to take some time on the Dr. America show to explore this a little bit more in depth. And, just to kind of help you guys set up some boundaries, I'm not going to spend too much time going into some of the labor issues that I feel my colleagues on We Act Radio have done an excellent job covering. And I'm not going to spend too much time covering the legal issues, which I feel other attorneys have spoken very knowledgeably about their concerns with the legal framework of the Trans-Pacific Partnership. What I really want to kind of focus on is what's at stake for health, what's at stake for patients, what's at stake for public health campaigns, and what can we do about it? So I'm really excited for today's show, actually, because we're going to be exploring something that is a little bit off the beaten path of regular health and medicine news. And we've got a really great guest. I'm really excited to introduce her to you guys. Her name is Eva Dominguez. She serves as a legislative representative at the Alliance for Retired Americans here in Washington, D.C. In March 2013, she also became the executive director of Latinos for a Secure Retirement. And prior to her current positions, Eva served as a senior policy advisor to Congressman Robert Wexler of Florida. And in that capacity, Eva advised Congressman Wexler on healthcare policy, including Medicare and Medicaid, pensions, veterans, and foreign policy issues in the Western Hemisphere. Prior to her time on Capitol Hill from 1990 to 96, she worked for then Florida State Senator Robert Wexler, and from 1988 to 1990 for Florida House Speaker Tom Gustafson. And Eva has debated retiree issues and its effects on Latinos on Univision, including Perspectiva Nacional with Armando Guzman. She has also been a guest on several radio shows, and now including Dr. America, including Cara a Cara con las Financias on KTNQ 1020 AM, AARP's Viva su Segunda Juventud, and Pivot Point with Maya Rockymore. It's a big mouthful, that last sentence, so sorry if I stumbled there a little bit. Eva, thanks so much for joining us today.
Thank you so much for having me on the show, Dr. America.
So, I wanted to kind of take our time with the Trans-Pacific Partnership because I feel like there's a lot of moving pieces on this puzzle, which I don't know if all of our listeners are familiar with. And, I guess what I wanted to start with was, I had been seeing in the news about this thing called Stop Fast Track. What does that mean? Like, what is Fast Track and why are we trying to stop it?
Sure. Well, basically, Fast Track is it's the name of the legislation is Trade Promotion Authority, but it's better known as Fast Track, and it is basically an ability to expedite the passage of trade agreements, and this would include agreements like the Trans-Pacific Partnership Trade Agreement, what's also known as TPP. So Fast Track is just a process that Congress would pass before tackling TPP, and it just would allow for an up or down vote of trade agreements.
So it sounds like that means that people have to either take it or leave it. Like they want to kind of...
You cannot amend it. You cannot make any changes to it. It's either a yes or a no vote.
Okay. Now, if you're not allowed to amend it, what happens if a member of Congress sees something in there that they want to raise questions on, or they want to, they feel that maybe there's, a vulnerability for, people that they represent? Does that member of Congress not have an ability to even question it?
Basically, no. I mean, the only thing they'd be able to do is vote against it. And, there's supposedly the rationale behind fast track is that this allows the negotiaters more freeway in trying to negotiate these agreements, knowing that, whatever they agree to is something that will get included in the agreement that basically Congress can't take out of it. And so it gives them a little bit more leverage when they are negotiating with other countries. But some of these, some of the policies that are in the TPP trade agreement are just, it's so vast. It covers so many different things, and it's things that we really should be able to look at more in depth. And,
right.
The public should be able to have an input. Congress should be able to have an input.
Right. And so that's where, that was actually my second piece of my concern from a civic standpoint about how little we know about the Trans-Pacific Partnership, and that it's actually meant to be secretive. I was reading something about how hard it is for members of Congress, the ones who are curious to read, this bill, the ones who are curious to go through the details, that it's actually very difficult for them to actually study what they would be voting on.
Right. I mean, it's hard for them to get access to it, but yes, they actually, members of Congress do have access to it, as well as they're called cleared advisors. So certain specific individuals that have been cleared can actually, have some sort of say in the process. Can look at the trade agreement, but then they would not be able to discuss it with anyone else. They are not allowed to discuss it in public. They're not allowed to reveal what's in it. So it is very secretive, and the American public is not able to access what's actually there right now.
Right. So that already, those two pieces alone, the fast track piece and the secretive piece, already kind of make me feel very skeptical towards towards this this TPP. But to kind of bring it back to health, because what I saw about some of the provisions when it came to to helping people afford medications, I was really concerned when I saw groups like the American Foundation for AIDS Research and other groups, talking about how TPP could actually change access to affordable medications for patients?
Yes, and basically, let me explain that a little bit. As we were talking, we don't really know what's in the agreement, but there was leaked language that basically showed that the TPP trade agreement has provisions that pharmaceutical companies are pushing to basically establish 12 years of market exclusivity or patent protections for biologics for all TPP countries. Now, biologics are drugs that treat certain chronic illnesses and immune diseases. While the current patent protection in the United States is set at 12 years, many of us have been trying to reduce that period to 7 years. And this is so that these drugs can be more affordable and it can be more accessible to people. And I know that you know this quite well, and patients who use biologics know this quite well, and that's that biologics are extremely expensive. They're upwards of $1,100 a month. If you take, for example, rheumatoid arthritis, if someone were to take Humira, which is one of the biologics to treat it, the cost would be anywhere between $2,632 and $5,264 per month for a 40 milligram injectable kit. And so President Obama agrees that the patent protection period is of 12 years is really long, and he agrees that we need to try to reduce it to 7 years, and he actually included this in his budget. Yet we have these U.S. negotiators that are trying to put into law or into I should say, into this agreement that would affect the U.S. as well as all these other countries. And in fact, in some of the other countries, the patent protections are not that high,
right?
And yet they're trying to make it 12 years. And so, this is something that would affect, as you know, it would affect people suffering from rheumatoid arthritis, multiple sclerosis, Crohn's disease, psoriasis, psoriatic arthritis, chronic pain, and even some forms of cancer.
Right.
So,
and I mean, and the thing is, like, all the diseases that you just listed off, I mean, as a physician, as somebody who's taking care of patients with those conditions, I think the conditions are enough of a burden to bear. I mean, it's enough pain and suffering to have to contend with any one of those conditions that you just listed off. But then it feels like this is, adding insult to injury by making these medications, which are there. I mean, like, it's not that science hasn't invented something to treat people, with these conditions. The science has done its job, but we're going to let businessmen and lawyers, stop access?
Right, and the thing is, like, what good is medication if people can't afford it? And so we think that, yes, these companies should be able to get some patent protection so that they can get back some of their investments, but, there is a limit, and we don't think that they should be, they should be pushing to, to have to increase this and to really deny people who need medications, these life-saving medications.
So, and I've heard similar concerns from, from groups that are trying to do right by patients with AIDS and HIV. And then, the next set of health experts that I found compelling to hear from were from those people who were concerned about how can public health agencies implement their campaigns to, keep their populations healthier when they're being told by their government and by, people from the TPP crew, if you want to call them that, that, by doing a public health campaign, they might be in violation of TPP. And I just found that, striking that, public health groups are going to be, restricted by a free trade agreement. And have you heard much about this? Are there examples of this already happening?
Well, yes, let me explain what it is. Basically, in this country, we have various public programs that pay for prescription drugs for low-income beneficiaries, for seniors, the disabled, for veterans. And these are, programs like the Veterans Administration, Medicaid, the Part D prescription drug program under Medicare. In order to participate in these programs, pharmaceutical companies must provide the government with either rebates or some sort of discount. However, there's actually under TPP something known as Investorstate dispute resolution, and this would allow a foreign corporation or a subsidiary to sue a government if their profits were being undermined. So basically, these foreign drug companies, or it could be a U.S. company that has a subsidiary overseas, could make the case that under these public programs, by the mere fact that they have to provide these discounts, that's eating into their profits and it is in violation of the trade agreement. And they could bring up a lawsuit against the government for these. So they could bring a lawsuit against the Medicare program if the agreement is allowed to go forward.
Right. And, I'm glad that you brought up the Investorstate dispute settlement, because what I found really concerning was that, that this would actually give big tobacco an opportunity to tell countries that wanted to put warning labels on cigarettes, like countries that haven't done that yet, that they could actually tell these countries in an ISDS that they are cutting into big tobacco profits when they try to warn people about the dangers of smoking.
Absolutely. I mean, they could totally do that. And there are all kinds, and it's not just, subject to, health. It's all kinds of areas. It's the environment. It's a number of things. But we already know of cases going forward. In fact, I know there's a case in Germany where they've decided to, after the big accident in Japan, to not have nuclear energy. And the company that's decided to invest in Germany now is suing the German company for them trying to make to basically make their country nuclear free and be more be safer for the German public. So this is, it could be anything, but yes, absolutely. In the area of healthcare, this is very big as well.
And, coming back to, to Medicare for a second, I was curious, one of the things that I found kind of striking about how TPP, strikes at home is this issue of using Medicare to pay for the Trade Adjustment Assistance, the TAA. And I guess, I guess you, can explain this better than I can about how the TAA helps workers who have been laid off. But then, Medicare is going to be used to pay. It feels like, we're already demanding a lot out of Medicare, and then, Medicare is going to be leaned on some more. Could you, help us make sense of this?
Sure, absolutely. As you mentioned, trade adjustment assistance is something that kind of goes hand in hand with any trade agreement, and it basically basically provides assistance, things like worker retraining. They provide economic assistance. They provide help to cover for health coverage for displaced workers, and it's something that usually accompanies trade agreements, and it's something that our organization supports very much. However, the agreement that's pending before the Senate and in the House basically has Medicare paying for trade adjustment assistance, for TAA, which makes absolutely no sense because, as you mentioned, Medicare. First of all, Medicare, has nothing to do with displaced workers. It's when people pay into the Medicare Trust Fund, it's to cover them when they retire or if they become disabled and they have access to Medicare. When you put money into the Medicare Trust Fund, you expect that that's what they're going to use it for. But now the government is basically going to Medicare as a piggy bank to pay for different programs. And this has actually been done a couple of times where they've, tried to go to Medicare to provide funding for this. And in this case, we think that it's really horrific that they're actually doing this. And they're basically pitting displaced workers against seniors. And it really has no place in this at all. And we think it's a complete disservice. And as as an organization that advocates for retirees, we're really concerned about this portion of having the TAA be paid for by Medicare.
Well, I think that one of the things that I've always found concerning about these kinds of debates is how we seem to get trapped into these false choices of, do we help seniors or do we help displaced workers? As if, we're not supposed to be helping both of them, And, I find that that these kinds of issues like, trade agreements seem to be unusual in the sense that we have to struggle with false choices when we're not really asking enough from the people who have a lot, namely corporations that stand to make huge amounts of money off of these free trade agreements.
Exactly. If people are being displaced as a result of these trade agreements, then you're absolutely right. It should be corporations that are paying for this, and not Medicare beneficiaries, not disabled, or retired beneficiaries.
So, so for our listeners who have, now learned a lot and are very eager to take action, where can we direct them?
Sure. Well, I think one thing is to contact right now. Congress and basically the Senate is going to be voting this week on TPA or fast track, and they're also going to be voting on TAA. So it's really important to contact your senator, and let them know that that you're opposed to the trade agreement, you're opposed to fast tracking it through the process, and that you're opposed to Medicare having to pay for TAA. This is all happening in the Senate this week. The House is also expected to be voting on this. It will be sometime after the Memorial Day recess. So also calling your congressman or congresswoman, to express your concerns is very important.
Okay. Well, Ms. Dominguez from the Alliance for Retired Americans, thank you so much for joining us today on the show. We really appreciate all these valuable insights. I think that this was a very helpful discussion for people who don't know very much about TPP to, get them started on the road of, learning more, doing more, and hopefully, keeping our priorities straight as we try to look after, patients, retirees, and workers. So thank you so much for joining us.
Thank you for having me. Bye-bye.
Okay, thank you. So, thank you guys for tuning in for this part of the program. I know that the, Trans-Pacific Partnership is, it feels complex. It can feel, very overwhelming to, go to your job and then you have to come home and learn about all of this. And, the way that I usually handle situations like this, is that whenever I'm faced with, okay, wow, I just had a long day in clinic seeing patients and now I'm trying to wrap my mind around something as complicated as the Trans-Pacific, partnership, is that I usually try to understand it from what I know best. And what I know best is, what I would want for my patients. And when I see, trade agreements that affect things that are so basic, like we've been talking about so far, the cost of medication, the ability for public health to actually do things for the greater good of the population, like educate them about the dangers of smoking. When I see that, when I see things that are really basic, like how do we control the amount of carbon dioxide in our air? How do we make our air cleaner, our water cleaner, so that we can breathe and drink it, comfortably? That's what's at stake in the Trans-Pacific Partnership. Even if we have a hard time understanding the nuances of the civics that are involved, of the legalities of the things involved, if our priorities are that we want, patients to be able to get the medication that they need in a timely way, in an affordable way, then this is not a good deal. If we believe that, we want, our air to be clean and our water to be clean, regardless of where we are, regardless of what side of the Pacific Ocean you live on, if you believe that your environment should be clean, then it's really hard to see how the Trans-Pacific Partnership is helping any of that. And so I would say that, if you know what your core values are, and as you're learning from this program and as you go on to, look at the Alliance for Retired Americans materials on TPP, hopefully you will pick up that phone, talk to your senator, and do something about this, because trade agreements should not be rushed through Congress in a secretive way and then ultimately affect some of the most basic things in our lives, like the cost of medication and the cleanliness of our air. So take a moment, please call your senator, let them know what you think, and let's keep this discussion going. Trade agreements should not be secret. All right. Thank you so much for joining us so far. We're going to be right back with more health news. You've been listening to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram, and we'll be back in just a minute.